Hi, welcome to my channel. I just wanted to go over this medication. It's called Forteo. It's a daily injection. You're supposed to take it, I think for a year or two, or up to 2 years. And after 2 years, you're supposed to stop for like a month or so. And because this can cause some type of cancer, so you have to have like a pause after 1 or 2 years. Just talk to your doctor. So this is a daily injection, and with the prescription that we get, we also get a red bin, and then this is the needle, and then the cotton, not the cotton, but the alcohol swabs. See that? So what you would do is you uncap it, you use the needle, you peel off the and I'll show you. This is just like the instructions, but when I first saw this, I was like, oh my God, I cannot do pictures. Like, what the heck? I had to watch a video, and it's actually pretty easy. It's actually not that bad. But for those of you who are just interested in the injection, and to get this prescription, your doctor would have to determine which one, because there is different injections out there or medications to regenerate bone growth. See, this paperwork right here is from here. See that? So see, this is this. And then this is just the dosage sheet, which you don't even need because the pharmacy has already figured that out. See, it's this. So we're just gonna skip these. Put them aside. So this is what the pen looks like. But I will show you. It's just that when I first read all this, I was like, oh my God, this is so confusing. And I was so nervous because I was like, well, it's something new that I wasn't familiar with at all. But I do have some information that I want to tell you if you are a user of Forteo. This, you can, we got this through CVS, right? So your doctor would prescribe all this to you, these 4 things. And what it is that I need to like tell you is that your doctor would have to really be persistent in calling the pharmacy, because with my person who's using this, that I use this on, their doctor was kind of lazy, or their assistants were just kind of lazy, or maybe just too busy. I just really don't know. Like, we had to be persistent. I was actually persistent, but it was the doctor's office that was more like, that wasn't really doing their job. So I had another doctor who was authorized to call CVS Specialty, and you could reorder this stuff on the CVS Specialty online, and I think there's an app too. But they send you a link to your text message, and and from there I tap the link and I do a login, and when you do requests for refills, it does ask you how many are left, or how many injections are left. And what you want to do is that this shot injection thing, it's daily, so it's once every 24 hours. And this is already pre-counted to 28 days. So this pin expires in 28 days from the first usage. So today would be the first usage. All right. And you don't have to reorder this. Actually, we have these accumulating. I'm probably going to give some away. Yeah. So just probably order this like once every 3 months, maybe. And then also regarding about this, when you get a new order, because you have to reorder before you run out, right? So you're going to end up, when you reorder, you're going to end up having like another one of these and you think that you want to just throw them all in the same bag, don't. Because then you won't know how many days you have left. Does that make sense? So when we had gotten to our second order, I did mix them up. And then I realized, oh my gosh, I shouldn't be doing that, because then how would I know, you know, the dosage remaining, you know, from the pen. So you don't want to do that. So you just want to keep these separate when you get a new refill. So you want to take this off. And these do have to be refrigerated. And one time I was busy helping my person get ready for their appointment, their like a doctor appointment, and this had gotten delivered like about a month ago, or actually 2 months ago. And I took it out of the package and I put it on the counter, and I forgot about it for like 8-9 hours. And I did Google it, and it said that you could have this not refrigerated for up to no more than 36 hours or 35 hours, because you're supposed to refrigerate this. So I was like shit scared. I was like, oh my God, like what am I going to do? I'm like, am I going to have to request a new one? But you're fine. It's just like I said, when the package came a couple months ago, I was trying to get my person ready for their doctor's appointment. So what you want to do, see if I could do this one-handed. Undo this. And you want to wipe this, like wipe it. And you do want to sanitize your hands or wear gloves, but I'm just going to do like a little quick demonstration. And yes, my hands are clean. You want to peel this. See that? You want to peel that. And then you want to put this on, insert it, twist it on. And then what you want to do is you want to pull this all the way out, like that. See? And you want to make sure you see that little red line. And then when you're ready to do the injection, take that off, of course. Take this off. Take that off. And then you want to swab the area. And right here it's going to say you want to swab it and to use your abdomen or the thigh. Does that make sense? And so then, but you want to pull this when the cap is on. So then you just give the injection, obviously, you know, where it says hold the skin of your thigh or abdomen, just like that in the picture. And then what I do is I put this back on when I'm done with the injection. And then screw the whole thing off. See how the needle tip isn't there anymore? And I throw this and all this stuff in one of these. And then you want to close this. And then put it back in the refrigerator. But obviously, after giving the injection, this goes back down. And these injections are they're what do you call it? They're and I don't want to waste this because I'm actually going to use it on my person. Like the injections are like filled. So there's no need for you to do, it's nothing like insulin where you have to calculate how many milliliters, you know what I mean? Or not millimeters, but I forgot what they are for insulin. Does that make sense? I'm trying to zoom in for you, but I have a new phone, the 14, but for some reason it doesn't really zoom in good, but I'm sure you get the idea. So yeah, I'm going to use this on my person. And this is a new prescription that I'm starting a new 28-day cycle. Okay. And then if that's all you wanted to know, you can go ahead and exit the video, because I'm just going to go more in depth with stuff. And see back here, it's just more cleaning and storage. Disposal of pins and needles. See, this is just a dosage sheet. You don't need that. Just, I mean, because it's already pre-dosed with each pull that you do. And then this is just getting started as a CVS specialty client. My person does have their medications prescribed or, you know, sent to CVS like the regular meds. But as a CVS specialty, which is out in Pennsylvania, this is just like a welcome packet thingy. Like, you know what I mean? Important steps to get started as a client of specialty medicines. Because Forteo isn't like a common medicine. So the local CVS does not carry, at least not this one here where we live. They don't carry Forteo. And do you see, it's just safety and storage, just giving you ideas of what. I mean, I'm not going to go through this booklet, but I'll flip through each page, but it's just, it's nothing really. I don't know. I'm just customer care, non-discrimination, and then, yeah, it's just really nothing. And then this, you'll get one of these, maybe, I don't know if we got this last time. It just tells you what came in the delivery, and it comes shipped in a white box with arrows pointing up that says this side up, and it says keep refrigerated. Even this says it, where it says refrigerate. Do you see, oops, those blue letters? And then this just gives you like information about, sorry, I can't really zoom in. I hate this phone. I'm sorry, people. What is the drug used for? What do I tell my doctor before I take this? See, this stuff you don't want to worry, because your doctor would be the one prescribing it beforehand, before even receiving any of this. Does that make sense? What are some of the things I need to know while I'm taking this drug? This, I will be reading it off of this for y'all, okay? And I did some highlights of like the important stuff. See, like right here, how is this drug best taken? What are some of the side effects? And it's all on that sheet that I will be reading. And it's just the same stuff, kind of what's on this on here. And then this tells you what to do with the red bin when you're done filling it up. See that? You contact this number. And the patient update information. So that's just, yeah. Okay. So right here, it says possible bone cancer, osteosarcoma in patients using Forteo beyond 2 years. Oh, see right here, it says like beyond 2 years. Treat postmenopausal women who have osteoporosis, who are at high risk of having broken bones, fractures, or who cannot use other osteoporosis treatments. I mean, your doctor would have to find out which osteoporosis medication is best for you. So let's see. And so the next highlights is symptoms of a serious allergic reaction of Forteo may include swelling of the face, lips, tongue, or throat that may cause difficulty in breathing or swallowing. And this is part of the section where it says who should not use Forteo. And then up here, I didn't highlight anything, But I will go over, I'm just going to go over the highlights because I'm trying to help whoever is just looking for the main points or the main important stuff they could carry on with their day and not waste time watching the whole video. How should I use Forteo? Before you try to inject Forteo yourself, a healthcare provider should teach you how to use the Forteo delivery device to give your injection the right way. Okay, so I was told from CVS Specialty that somebody was going to have to teach me in person, but obviously that was not possible. They told me to go ahead and look up like, I think it was like Forteo.com or something like that. But it ended up just being a video, which wasn't that helpful. I had a YouTube. And look, and here I am making my own YouTube video. Inject Forteo 1 time each day in your thigh or abdomen, lower stomach area. Enough medicine for 28 days. It is set to give a 20 microgram dose of medicine daily. Do not transfer the medicine from the Forteo delivery device to a syringe. What this means is, you know those needles that people use for, like, say, insulin? How you have to use a bottle and, like, fill it, however, the dose the doctor... It's just telling you don't use one of those syringes to inject the Forteo out of the pen. You don't want to do that. Forteo should look clear and colorless. Inject Forteo right away after you take the delivery device out of the refrigerator. After each use, safely remove the needle, recap the delivery device, and put it back in the refrigerator right away. First few doses of Forteo, make sure you are in a place where you can sit or lie down right away in case you feel dizzy or have an abnormal heartbeat after the injection. Oh yeah, shoot, I forgot to include that when I was instructioning this. Yes, after the injection, you should be laying down or sitting down for at least 20 minutes. Just in case if you have any dizziness or abnormal heartbeat where you're going to faint or something. And then it says, if you take too much Forteo, you may have nausea, vomiting, weakness, or dizzy. And I would say, how much is too much? I mean, it's pre-dosed. I mean, I think... See, what I do is I use an app where I keep track of medications, of what time and date I administer them to my person or even to myself. So there should be no too much. Does that make sense? And then you should not use Forteo for more than 2 years over your lifetime unless your healthcare provider finds that you need longer treatment because you have a high chance of breaking your bones. So yes, I remember I was told by a healthcare provider that 2 years is the max, but if you need more, they'll give you like a month break or something like that, or a couple weeks, or is it a month? I don't know, because we just started this in June for my person. So my person, you know, we just started this in June of 2023, so I'm not there yet to have personal experience for this. What are the possible side effects of Forteo? Increased calcium in your blood. And obviously these are other important factors, but I'm just reading the highlights of what I thought was more important. But I will go back and run through the unhighlighted. The most common side effects of Forteo include pain, nausea, and joint aches. Let's see. And this is confusing because when you're older, which is mostly clients who use Forteo are older, they already have joint aches and pain. And so that would be kind of hard to distinguish the side effects or something that's already been pre-existing. Call your doctor or medical advice about side effects. You may report the side effects to the FDA at 1-800-FDA 1088. And that's all the highlights. So, and I did forget to say that this also came in the box, which is this form that I had already highlighted. Is because this is from a different shipment. The first shipment when I was trying to learn. So this could be set aside too. Okay. So now I'll just go over like all the black stuff that I didn't highlight, the black letters. Okay. So if you have, you know, like the main idea, you don't have to stay for the remaining of the video. All right. So let's start from here. Read this medication guide before you start using the Forteo, and each time you get a refill, there may be a new information. So also read the user manual that comes with the Forteo delivery device pen for information on how to use the device to inject your medicine. Where am I? It's just hard to read the paper and try to make sure that I'm looking at the screen to make sure this is on the screen. The medicine the right way. This medication guide does not take the place of talking with your healthcare provider about your medical condition or your treatment. What is the most important information I should know about Forteo? I had already put possible bone cancer during drug testing the medication. Then Forteo caused some rats to develop a bone cancer called osteosarcoma. Studies in people who have not shown that Forteo increases your chance of getting osteosarcoma. There is little information about the chance of getting osteosarcoma in patients using Forteo beyond 2 years. What is Forteo? Forteo is a prescription medicine used to treat postmenopausal women who have osteoporosis, who are at high risk of having broken bones, fractures, or who cannot use osteoporosis treatments. Forteo can lessen the chance of broken bones, fractures in the spine, and other bones in postmenopausal women with osteoporosis. Increase the bone mass in men with primary and hypogonadal osteoporosis who are high risk for having broken bones, fractures, or who cannot use other osteoporosis treatments. Treat both men and women with osteoporosis due to the use of glucocorticoid medicines such as prednisone, which is what my person takes daily, for several months, who are high risk of having broken bones, fractures, or who cannot use other osteoporosis treatments. It is not known if Forteo is safe or effective in children. Forteo should not be used in children and young adults whose bones are still growing. Who should not use Forteo? Do not use Forteo if are allergic to any of the ingredients in Forteo. See the end of this medication guide for a complete list of ingredients in Forteo. And then right here, which I already read, symptoms of allergic reaction of Forteo may include swelling of the face, lips, tongue, throat that may cause difficulty in breathing or swallowing. Call your healthcare provider right away to get emergency medical help if you get any of these symptoms. So I'm just reading this for y'all who don't want to read it, and you just sit back and just listen if that's what you'd like. What should I tell my healthcare provider before using Forteo? Before you use Forteo, tell your healthcare provider. I'm sorry, the darn phone. Okay. If you have certain bone disease called Paget's disease or other bone disease, have bone cancer, or have had a history of bone cancer, are a young adult whose bones are still growing, have had radiation therapy, are affected with a condition that runs in your family that can increase your chance of getting cancer in your bones, have or have had too much calcium in your blood, hypercalcemia, have or have had a skin condition with painless sores or wounds caused by too much calcium, have or have had kidney stones, take medications that contain digoxin, I don't even know if I pronounced that properly, are pregnant or plan to become pregnant. It is not known if Forteo will harm your unborn baby, are breastfeeding or plan to breastfeed. It is not known if Forteo passes into your breast milk. You should not breastfeed while taking Forteo. Tell your medical health care provider about all the medications you take. Obviously, the doctor would already have known this before even getting any of this stuff. You know what I mean? Including prescriptions and over-the-counter medications, vitamins, and herbal supplements. Know the medications you take. Keep a list of them to show your healthcare provider and pharmacist when you get a new medicine. How should I use Forteo? Read the detailed instructions for use. User manual included with your Forteo delivery device. Use Forteo exactly as your healthcare provider tells you to. Your healthcare provider will tell you how much Forteo to use and when to use it, which, like I said, the pin is already pre-dosed with each pull that you do on the end of the, the tip of the pin, the end of the other end, where the handle is at. And I already read this. Before you try to inject Forteo yourself, our healthcare provider should teach you, which I already told you that they just told me to watch a video. Inject Forteo 1 time a day in your thigh or abdomen. Okay, so I'm going to go more in depth with this, all right? So let's just say you inject at 6 in the morning. You want to inject each day at 6 in the morning. But let's just say you accidentally forget and you end up injecting it at 8 a.m. Well, on the third day, because the first day was at 6 a.m., the second day you accidentally did it at 8 a.m. This is just an example. The third day, you need to keep it consistent with 8 a.m. You cannot go backwards. Does that make sense? Because they don't want you, and I guess that would be the not the overdose, but the too much. Does that make sense? Remember this somewhere over here where it says if you take too much. That's where I'm thinking now that I think about it. Well, I think that's where I'm thinking that where they're talking about that if you take too much, right here, where it says 1 time a day, but then over here it says if you take too much. I think what it is that that timing, it will happen. I'm not going to lie. It will happen where you are going to forget, because you have other things to do, if you have kids or other people you care for, or, So anyways, like I said again, if you did the first injection at 6 a.m., you want to keep it consistent. 6 a.m., 6 a.m., 6 a.m. daily. But if you accidentally forget and on the second day you give it at 8 a.m., you have to continue doing it at 8 a.m. Does that make sense? You can't go backwards and do 6 a.m. again. No. Does that make sense? You can't go backwards. You can only go forward. So let's just say you keep forgetting and it ends up being 8:30, then you have to keep it 8:30 every day. But if you accidentally forget again and you ended up giving it at 10 a.m., well, then that's the time you're going to have to start for the other days. Does that make sense? You just can't go backwards. And I'm not going to lie, it's happened to me. Okay, do not inject into a vein or a muscle. Talk to a healthcare provider about how to rotate injection sites. Yes. And I did forget to mention that when I was on here. Sorry. You don't want to use the same injection site. You just want to like different spots on the abdomen. Like you could even go like here, and like, you know, the abdomen, and then start all over again, and then does that make sense? And then the Forteo delivery device has enough medicine for 28 days. It is set to give 20 microgram dose. Do not inject all of the medicine of the Forteo delivery device all at one time. And it means the whole pin. I mean, who's going to do that? Do not transfer the medication from the Forteo delivery device to a syringe, which we already went through. This can result in taking the wrong dose of Forteo because, like I said, the pen is already pre-dosed. If you do not have pen needles to use with your Forteo delivery device, talk to your healthcare provider because you do need those. You do need those. And Forteo should look clear and colorless. Do not use Forteo if it has particles in it or if it is cloudy or colored. Inject Forteo right away and then put it in the refrigerator. After each use, safely remove the needle, recap the delivery device, and put it back in the refrigerator. When you inject the first dose of Forteo, make sure you are in a place where you can sit or lie down, which we already talked about feeling dizzy. To make sure you are sitting down for 20 minutes after the injection. Do not take more than one injection in the same day. Do not share your Forteo delivery device with other people. Of course not. Everybody's different. If you take more Forteo than prescribed, call your healthcare provider. If you take too much Forteo, you may feel nausea, vomiting, weakness, or dizziness. You should not use Forteo more than 2 years, which we already went over. If your healthcare provider recommends calcium and vitamin D supplements, you can take them at the same time with Forteo. What are the possible side effects? Forteo may cause serious side effects, including what is the most important. Oh, see, we already went over that. Bone cancer, osteosarcoma. Tell your healthcare provider right away if you have pain in your bones, pain in any areas of your body that does not go away, or any new unusual lumps or swelling under your skin that is tender to touch. Increased calcium in your blood. Tell your healthcare provider if you have nausea, vomiting, constipation, low energy, or muscle weakness. This may be signs that there's too much calcium in your blood. Oh. Okay. Worsening of your kidney stones. And so the calcium, you will only know if you have too much calcium is by labs. My person did labs and they did have a little bit of elevated calcium. So I'll have to figure that out. Worsening of your kidney stones. If you have or have had kidney stones, your healthcare provider may check the calcium levels in your urine while you use Forteo to see if there is worsening of this condition. A decrease in blood pressure when you change positions. Some people may feel dizzy, get a fast heartbeat, or feel lightheaded right after the first few doses of Forteo. This usually happens within 4 hours of Forteo, which I was told by the pharmacist 20 minutes, not 4 hours, and goes away within a few hours. For the first few doses, give your injections of Forteo in a place where you can sit or lie down right away. If you get these symptoms, if your symptoms get worse, do not go away. Contact the healthcare provider before you continue use. I already mentioned those, the nausea, joint pains. These are not all the possible side effects of Forteo. For more information, ask your healthcare provider or pharmacist. Call your doctor for advice or that number. How should I store Forteo? Well, that's already been explained. Really, just keep it in the refrigerator with the cap on. And don't leave those pen needle thingies on. See, it says recap. Do not, Do not use Forteo after the expiration, which there should be an expiration somewhere on here, but usually it's 28 days. You don't want to use it past 28 days. I don't know if there is an expiration, to be honest. But I think they're talking about the general expiration date, March 12th, 2015. Well, who's going to do that? And then let's see. Keep Forteo and all medications at a reach of children. General information about the safe and effective use of Forteo. Medicines are sometimes prescribed for purposes other than those listed in a medication guide. Do not use Forteo for a condition for which is not prescribed. Do not give Forteo to other people, even if they have the same symptoms that you have. It may harm them. You can ask your pharmacist or healthcare provider for information about Forteo that is written for health professionals. What are the ingredients? And this is just, yeah. So I guess these are the ingredients that they want you to look at if you're allergic to any of that. And if you are allergic to any of those ingredients, just don't take it at all. Talk to the doctor and tell them, hey, give me something else because I'm allergic to whatever. And that's about it. I'm trying to remember if there's like other important information. But that's about it. And don't forget, don't combine these with a new month. Because when you do reorder, it's going to ask you how many doses are left in the pin. There's no way of knowing. I already put the pin in the refrigerator. There's no way of knowing unless you know how many of these are left. So if there's 2 left, then that means there's 2 doses left. Because when you do reorder, it's going to ask how many doses are left. And they will send a link when the system realizes, hey, she's almost due for a refill. So don't mix these up with the new month. Keep them separate. All right, thank you. If you have any questions, just don't hesitate to message me on this video. Thank you.